Bună dimineața, dragii mei! În timpul călătoriilor mele prin spitalele din străinătate, am stat de vorbă cu o serie de medici și, din fericire, cercetările care s-au făcut în sectorul oncologic au condus la dezvoltarea unor terapii inovatoare, iar despre aceste noi terapii vom discuta în ediția de astăzi. Brachiterapia este subiectul interviului următor. Acest tip de tratament este pentru pacienții diagnosticați cu cancer, atât în fază incipientă, cât și în fază avansată. Ce tip de pacienți sunt eligibili pentru acest tratament oncologic, aflăm în minutele următoare. Domnul doctor, pentru început vreau să ne explicați ce este brachiterapia.
Brachytherapy is a form of radiotherapy. We use radioactive sources and we put radioactive sources into the tumor or near to the tumor. The aim of brachytherapy is to give high dose radiation to the target. And while doing this treatment, we have to protect organ at risk. And there are two types of brachytherapy. One of them is intercavitary and the other one is interstitial brachytherapy.
Cine este candidatul perfect pentru brachiterapie?
We can do in all patients brachytherapy, but the first diagnosis is GYN cancers. For example, cervix cancer, uterine cancer, vulvar cancer. But we can do also in prostate cancer, lung cancer, nasopharyngeal cancer.
Care sunt pașii principali ai tratamentului?
First of all, we evaluate patient, diagnose pathology results, MRI and PET results, and then we have a tumor consult. And in this consult, there are radiology, nuclear medicine, GYN surgeons, and also medical oncology and radiation oncology doctors. In this consult, all we decide to give which treatment is perfect for patient. And then if we choose external radiotherapy plus chemo and then brachytherapy, and we start the treatment with external radiotherapy with combined chemotherapy. And then after finish external radiotherapy, we evaluate patients again for brachytherapy. GYN exam is important because we insert radioactive sources into the patient, into the tumor or into the cervix. For this reason, we have to evaluate cervix or uterus is okay for this application. If we evaluate a patient is okay, we insert an applicator to the cervix. For this, we use ultrasound also, because if we don't use ultrasound, sometimes uterine perforations can be done.
Care sunt efectele secundare posibile?
Side effects are not different from external radiotherapy. It's same fatigue, urinary or defecation, incontinence, hematuria, dysuria, or rectal bleeding. We can see all these side effects, but we don't see in all patients.
Puteți să-mi spuneți care este rata de succes a tratamentului?
For success rate, we have to evaluate with external radiotherapy because we don't do this treatment alone. For example, GYN cancers, for example, cervical cancer, first of all, we use external radiotherapy and then we use brachytherapy. And For this reason, we have to evaluate in combination. But if we do all these treatments higher than 90% is good.
Care sunt factorii care pot influența succesul unui ciclu de tratament?
Stage is the most important factor. And then we have to check the patient's status. If patient can take external radiotherapy, brachytherapy, and chemotherapy, this is the best treatment. But if we cannot do any of them, for example, if we can give just external radiotherapy and brachytherapy, the results are not good.
Există riscuri asociate cu tratamentul?
Of course, there are some risks, but we have to eliminate the risks. For example, uterine perforation is a risk, but to eliminate this risk, we use ultrasound. For this reason, we don't see any risks while we are using this brachytherapy treatment.
Care sunt alternativele în cazul în care acest tratament nu funcționează?
There is no same effective treatment as brachytherapy. If we cannot do brachytherapy, of course, we have to choose a treatment. For example, external radiotherapy. For example, stereotactic radiotherapy. But the effects are not equal. For this reason, if we can do, we choose first of all brachytherapy.
La final, aș vrea să știu dacă această procedură este una care necesită eforturi financiare mari.
For example, if we talk, for example, GYN cancers, we use 4 fraction for brachytherapy. And this reason, brachytherapy is cheaper than external radiotherapy because we use external radiotherapy for 25 fraction. And for this reason, brachytherapy is cheaper than external radiotherapy.